Should I start? Yes? Okay. Good morning. My name is Dr. Karen Cohen, and I'm the Chief Executive Officer of the Canadian Psychological Association. The CPA is the National Association for the Science, Practice, and Education of Psychology in Canada. Psychologists are Canada's largest group of licensed healthcare providers specializing in mental and behavioral health. Psychological services can range from the assessment and treatment of anxiety and depression in an adult, the assessment and management of developmental disability or behavioral disorder in a child, and the assessment and remediation of brain injury or dementia, to name only a few. CPA opposes the federal government and Canada Revenue Agency's plan, which will effectively tax mental health service. To provide you with some background, Budget 2013 included an unclear statement about changes to the GST, HST, and what is not considered a health service. The new tax came into effect immediately on Budget Day. The lack of clarity from CRA has led to great confusion about what is taxed and what is not taxed. Advice provided to our members from CRA has been inconsistent and contradictory during this period, which has now lasted almost 2 years. Canada Revenue Agency posted a draft policy statement for consultation in the fall of 2014 that sets out to clarify the new tax rules. This consultation ended on Saturday. The consultation confirmed our apprehension that this new tax will make it harder for Canadians to access care. In this document, CRA articulates a new vision of what is and isn't a healthcare service. Some examples of the types of services that are relevant to mental health that CRA will now tax include an assessment required by an insurance company to determine if an individual is eligible for insured benefits, assessment and reports about fitness to stand trial, an assessment or report to determine if a person qualifies for CPP disability benefits, and psychological services that may be provided in the context of a divorce proceeding. 1 in 5 Canadians will have a mental health problem or disorder in a given year, and only about a third of them reportedly seek and receive care. When it comes to psychological services, the gateway to care is often the private insurance industry. Psychological services are not covered by provincial health plans and are paid out of pocket by taxpayers or through private insurance. This means that Canadians already face significant economic barriers accessing needed service. Imposing a tax on this needed health service will make these barriers greater still. CRA's recent interpretation of the term qualifying healthcare supply is extremely troubling and ignores the fact that much of healthcare in this country is not covered through provincial health plans but is funded through private insurance. The most problematic aspect of this new tax is that these assessments may be necessary for patients to get the financial assistance they need in order to get psychological care so that they can recover from injury, illness, disorder, and disability. Unfortunately, CRA will now be taxing assessments done for the very purpose of helping an insurer determine the type or amount of benefits that the individual is entitled to receive. An assessment undertaken for a private insurer is no different than one undertaken for a publicly funded institution, such as a hospital. It is done because a patient presents with symptoms and problems which, when competently assessed, lead to treatment recommendations and ultimately to treatment. Whether undertaken through a public or private insurer, an assessment of a health condition always has a health purpose: to diagnose a condition and determine if the patient is a candidate for available treatment. This is healthcare. It is important to note that this is not a pocketbook issue for psychologists. It is not the psychologists who will have to pay the tax. It's going to be hardworking Canadians who have a health need that is not met by Canada's publicly funded healthcare system. Some of the assessments that we're talking about can be lengthy and costly. An assessment of brain function can take several days of test administration and interpretation and can amount to hundreds or even thousands of dollars. Tax on this amount is not inconsiderable. CPA has been in dialogue with the federal government on this issue for some time and is disappointed in their definition of a healthcare supply because it will have a negative impact on those Canadians who need psychological care. All psychological assessments have a health purpose and must be continued to be exempt from sales tax. We hope the government can reconsider its draft policy statement. Our recommendations can be summarized in 2 points. First, CPA opposes the proposed definition of the term qualifying healthcare supply. All psychological assessments must remain exempt from sales tax. Second, because of the prolonged gap between Budget Day 2013 and the policy guidance issued only in the fall of 2014, we further recommend that the tax not be retroactively applied. Canadians with mental and behavioral health problems deserve better. Thank you. I do, je vais faire mon mieux. Okay.
Je vais juste expliquer la problématique, puis quelles sont vos demandes en français.
Okay. Le problématique, c'est que les évaluations, oui, excusez-moi, les évaluations qui sont faites aux demandes des assureurs, oui, c'est ça, vont, si c'est une évaluation qui est demandée par eux autres pour déterminer c'est quoi le problème et c'est quoi le traitement qu'ils ont besoin, il y aura de la taxe là-dessus. Et pour nous autres, une évaluation, c'est la chose qu'on doit faire au début pour une patient pour déterminer c'est quoi le problème et c'est quoi les services qu'ils ont besoin. Soit que ça sera un service qui est payé par un assureur privé ou public. Ça fait le sens?
C'est les psychologues qui payent cette taxe-là, vous savez?
Non, c'est les Canadiens qui vont payer la taxe. C'est les psychologues qui vont charger la taxe. Et c'est le patient qui doit le payer si c'est une évaluation requise par un assureur privé.
Que des gens iront juste pas consulter, selon vous? Ça vous fait peur qu'il y en ait qui n'utilisent juste pas les services psychologiques?
Bien, on sait déjà qu'il y a des défis au accès aux services psychologiques. Ça va empirer le problème parce que maintenant, il faut payer dans la poche pour les services. Et encore, il y aura une taxe au-dessus si c'est quelque chose qui est demandé par un assureur pour donner les bénéfices pour payer pour le service au début. Okay.
That this needed to be taxed?
My understanding is it was around clarifying what is and isn't tax exempt. I'm not sure if it originated from certain issues or cases that arose, but the clarification actually didn't come, as we said, till the fall. So we've had this great long period where psychologists, and I would argue other health professionals, have been a bit in the dark about what is and isn't a healthcare supply as defined by CRA for the purposes of the tax.
What kind of feedback did you get during your consultation period?
Well, it was actually the CRA that did the consultation, but we went out to our members and encouraging them to read the draft policy statement. And what we submitted to CRA is a synthesis of the feedback we got. And essentially the message is that the reality in Canada is that when it comes to psychological services, they're not publicly funded. The way in which people have access to service that is funded to some extent is through private insurance. And we're talking about people who have challenges and problems that are among the most complex. Someone who's had a motor vehicle accident, maybe a head injury or post-traumatic stress, somebody who maybe's had a work accident, someone applying for disability. Those are the situations in which an insurer may say, I need an assessment to determine what is your condition and for your access to care. But without that assessment, then they're prevented from that access to care for those benefits to pay for the service in the first place. So the overwhelming response from our members is this is making a problem accessing care even more inaccessible. Yep.
Do you have any sense of how much money is involved in this? How much would be, I guess, collected through this loss of exemption?
Yeah, in the aggregate, it's hard to say, but as I was mentioning, is that this is likely to involve the kinds of problems that are the most complex. Like I said, someone applying for disability, motor vehicle accident, people who've had pretty significant problems and may have other kinds that involve brain injury or emotional functioning. Those kinds of assessments, if you're assessing someone's brain function, memory, concentration, attention, their emotional functioning, if you're assessing their function after that, it can take days of testing and test administration. It could be hundreds or thousands of dollars per assessment. So the tax on that is not an inconsiderable amount for someone to have to pay.
This could become a burden for small business owners, the sort of, I guess, maybe clinics, and it would have to do with the hiring of technicians that might not be health.
No, I think it's now that if more of what in our view is health service is not considered health services and is taxed, then there's a whole administrative burden for the health professionals to now charge and collect and remit the tax. And I think it's important to point out that we're speaking on behalf of psychologists, but it involves a whole bunch of other healthcare providers whose services, largely when provided in communities in the private sector, are not covered by public health insurance plans, and whose patients may rely on service to access to funded care. So it could include occupational therapists, physiotherapists, social workers, a great number. Oui.
Bon, vous expliquez ces taxes-là, pourquoi Vous avez entendu le gouvernement, vous les avez vus. Pourquoi on a décidé de taxer ces soins-là?
Ça, c'est peut-être une question il faut demander au Canada Revenue Agency, mais de ce que je comprends, c'est qu'il veut avoir une distinction, c'est quoi un service de santé et c'est quoi un service où le but est plus économique, accès aux bénéfices dans un programme d'assurance. Mais les deux sont reliés, comme je viens d'expliquer.
I just got off the phone with the CRA and they said, they would just be applying policies of the Department of Finance and kind of shirk that. And I'm wondering, but you're saying the CRA actually went out and did the consultation. And do you have an issue with the consultation itself or this decision, which I guess would originate in finance?
The fact that they posted the draft policy statement to try and create some clarity is terrific. It's just that we disagree with the way in which they're defining a healthcare supply. Yeah. Thank you. Thank you.